Hey dear soul, so today is about healing anxiety disorders in veterans. Anxiety disorders in military and post-military populations often look different from civilian anxiety. What appears as overreacting is frequently a nervous system trained for survival. Hypervigilance, exaggerated startle response, scanning environments for threats, panic attacks in crowded spaces, these are not weaknesses, they are conditioned survival adaptations. But when these adaptations persist outside of combat zones, they can disrupt sleep, relationships, work, and physical health. Some people may have these symptoms even if they haven't been to war as we know it. They might have an internal war in their household. Okay, today we'll break down how veterans heal anxiety disorders using exposure-based cognitive behavior therapy, acceptance commitment therapy, mindfulness-based CBT. So, what anxiety looks like in veterans. Common presentations. Constant environmental scanning, sitting with back to the wall in restaurants. Panic attacks triggered by noise, crowds, or unpredictability. Avoidance of highways, public events, or enclosed spaces. Irritability rooted in chronic physiological arousal. Muscle tension, gastrointestinal distress, sleep disruption. From a neurobiological perspective, the amygdala becomes hypersensitive to threat cues. The prefrontal cortex has reduced regulatory influence under stress. The autonomic nervous system remains biased towards sympathetic activation. Healing requires retraining both thought patterns and psychological responses. What is exposure-based CBT, cognitive behavior therapy? Exposure-based CBT is the golden standard for anxiety disorders. Core principle: avoidance maintains anxiety. Gradual exposure reduces it. When veterans avoid triggering environments, the brain never learns "I am safe now." Avoidance reinforces the fear loop. Psychoeducation. Veterans learn anxiety is uncomfortable but not dangerous. Panic attacks peak and subside. Avoidance strengthens fear conditioning. Understanding reduces secondary fear. Fear of fear, as an example. Hierarchy development. The veterans and therapists build a graded exposure ladder. For example, sitting in a parked car, low distress. Driving around block, driving on highway for 5 minutes. Entering grocery store at non-peak hours, attending crowded event. Exposure must be gradual, repeated, prolonged enough for anxiety to decrease naturally. Cognitive restructuring. Veterans often carry beliefs such as, if I relax, something bad will happen. Crowds are dangerous, I must stay on guard. Cognitive behavior therapy challenges distorted threat appraisals using evidence examination, probability re-estimation, behavioral experiments. Over time, the brain recalibrates perceived danger. Stay tuned for part 2.